Hey guys, Mike Taylor here with my explanation of the manipulation or move more subcategory for low back pain treatment. If you haven't already, be sure you go back and check out the diagnostic video for finding your own treatment-based classification before continuing with the exercises described here. So what is manipulation? Manipulation is used to refer to a high velocity but low amplitude mobilization at a joint's in range. Essentially, this means that a thrust is applied over a very small distance at a fast speed at that joint's in range. This can result in that familiar popping or cracking sensation that can oftentimes feel really good. Before we continue our discussion, we need to go over some ground rules first. First of all, manipulation is absolutely, unequivocally not being used to put your spine back into position. You're not out of alignment, we're not adjusting your anatomy. Second, the jury is still out as to what the actual popping sound is, but the research tells us that the positive benefits associated with manipulation don't actually require the popping sensation to be achieved in the first place. There are some emerging theories that suggest that manipulation actually does more to modulate our central nervous system versus our musculoskeletal system, as neuroendocrine markers have been observed to be changed immediately following manipulation. The science behind this goes way beyond the scope of this video though, so for the sake of today, let's just remember that manipulation is not being used to put you back together. In summary, you aren't out of alignment, the popping sensation is not your back being put back into alignment, we're unsure what the pop even is, and you don't even need the pop to reap the benefits associated with manipulation. Moving on. Following manipulation, many positive effects have been observed, including decreased pain and increased spinal and hip mobility. In my own practice, when indicated, I utilize manipulation to achieve these same goals and have achieved pretty good success overall with it when combined with other exercises. Before we dive into any treatment ideas, I just want to recap the diagnostic criteria that I covered in the other video. These are patients whose pain is not going to extend below the level of the knee. The pain should be more recent in onset, less than 16 days old. And these patients will also have reduced range of motion, performing lumbar flexion, extension, etc. So you're probably wondering, how am I going to do this myself? A manipulation involves having a therapist perform a technique on you. And so I have two options to address this. First option is you could seek out a skilled physical therapist to do their own evaluation of you, and if they believe it's indicated, they can perform the technique on you. The second option, and the one that I'm going to recommend that you do for the sake of this video, is focus on just mobilization instead. Remember, the popping sound and sensation that we get with manipulation isn't actually required to reap those same benefits. Our goal is to get more motion in our back, which can be achieved with repetitive mobilization. Sometimes I have patients who are fearful of manipulation or whose symptoms are too severe to get in the position to do so, and in those cases, I don't give up on them entirely. We just choose a different tool in our toolkit and press forward. In this case, utilizing gentle mobilization versus manipulation is going to be the option that I'm going to recommend. I don't really recommend trying to do a self-manipulation because getting in that position is going to make it pretty much impossible for you to relax enough for the technique to be effective. Additionally, people have a tendency to just keep cranking hard on themselves thinking, if I can just get this to pop, my back's going to feel better, only to just dial up their irritability overall. So I advocate for gentle motion that, while not quite as instantaneous in achieving that relief we're looking for, can be just as effective over time. With that said, here's an example protocol that you can use to treat your back pain according to the principles outlined in the Move More category.